Hello everyone, my name is Jacqueline Tiema-Massie and I look forward to serving as your teaching assistant this semester for HPA 400. Welcome again to the course. I've been the teaching assistant, the primary teaching assistant for the last 3 years. And this semester I'm taking more of an instructor role, so I'm looking forward to that and working very closely with all of you. Professor Weingart posed a question to Dr. Dobkin and I, and that was to briefly describe how social ethics has contributed to our intellectual development as a public health person. Our previous instructor, Professor Dan Schwartzman, who was also a lawyer by training, was the guru on social ethics. So we're going to be covering a lot of his material and also Professor Weingart's material. I'm no ways a guru on ethics, but just wanted to touch on a few points about how ethics has impacted me. So when I think about social ethics, I think about our code or standard of how we judge right and wrong, and what should be. For many people, this has been their family values, their religion, or what's just commonly accepted as the standard, the social standard. For me, it's been a mixture of most of these, but primarily my religion probably has been the most influential on how I take into account social ethics. My family is Christian. So I just wanted to give you 3 points of how social ethics has impacted me. And so the first, as an undergraduate student, I was first drawn to public health by hearing stories of how residents living in a CHA or Chicago Housing Authority complex were being impacted by increased cancer rates and deaths as a result of living near local landfills. I'm not sure if any of you are familiar with this specific CHA complex, but it's called Allgale Gardens. It still exists today, and is located near 130th and the Bishop Ford Expressway. So about 6,000 residents live there, but in the late 90s, early 2000s, they started a movement, an environmental justice movement, to bring awareness to the impact of living near local landfills on their community. The majority of the residents that lived there at the time were 95% African American families, and they were experiencing ill effects such as respiratory illness, unusual rashes, and according to a Tribune article at the time, a state health study also found that certain cancers were 5 times more likely on this side of the city's southeast side, versus the rest of the city. One resident in particular that stood out was Hazel Johnson, and she formed a grassroots organization called People for Community Recovery to bring awareness of environmental health concerns on residents, and to raise that awareness among residents and also among local officials. She also became known as the country's mother of environmental justice movement. My understanding is that that local grassroots movement in Allgale had a big impact on the broader environmental justice movement throughout the nation, which sought to use data to paint a clear picture of how environmental hazards were significantly and disproportionately affecting minorities and low-income areas, and how those areas were bearing the burden of the nation's pollution. As a young person unaware of public health in its full form, this got my attention, and I was motivated by this story to learn and study more about public health and its role in addressing similar societal problems. Another social ethics story that impacted me was hearing stories about my late paternal grandmother and my aunt growing up in rural Kenya. My father often told us stories about his family, but one in particular was that his mother had died giving birth shortly after giving birth had died due to that birthing experience. Ironically, many years later, and I believe this was in the 80s, my aunt, also my father's sister, also died due to birthing complications, giving birth in rural Kenya. So my love for children and also hearing stories about my family members and their experiences in this area drew me to want to study maternal and child health. So as a potential graduate student, I was drawn to UIC's Community Health Maternal Child Health program, and later accepted a job offer with the Chicago Department of Public Health as a public health administrator in the immunization program to better understand the role of immunizations in protecting children from childhood preventable infectious diseases. They kill so many children around the globe, but that are under control in industrial countries such as the U.S. So my role in the immunization program was to conduct quality improvement activities with immunization providers for a program called the Vaccines for Children's program. And this was a program that distributed thousands of vaccines for free to providers that serviced low-income children and their families that were underinsured or uninsured or unable to pay for vaccines. So in order to control childhood preventable diseases, CDC began this program, and it's available in all 50 states and U.S. territories. That was a second story that impacted me in terms of social justice and what the standards should be around the world, that everyone should be treated equally in terms of environmental protection, and that all children should be able to get the life-saving medications that they need to have and live a very productive life. The third piece I just kind of wanted to add to this is, so currently I'm a DRPH student, and my instructors often highlight how public health is called to solve wicked problems. Many times we don't clearly see these problems as public health problems, but we as public health students and public health practitioners know that they are. So problems such as infant mortality, violence, chronic disease, bioterrorism, drunk driving, smoking, Ebola, and the list goes on. And understanding that these are public health problems, and that we in the discipline of public health have the tools to address them, whether it's epidemiology, advocacy, policy development, partner engagement, or planning with our local, state, and federal partners to address these problems. So all of these have contributed to my experience as a public health practitioner, most of which has been in governmental public health on a local level. And I'm reminded also that as public health managers, that we have to constantly remind ourselves that we're here to serve the public, remembering the public in public health. And so keeping that at the forefront of my mind has helped me to stay focused on solving wicked problems, societal problems, and solving problems that impact the people that we serve. So these are just a few examples of how social ethics has impacted my work. And I'm curious to hear from you maybe about how social ethics has impacted you, and maybe if you even have any comments about what I've shared, I would love to hear that also. Thank you so much, and I look forward to working with you and learning with you as the semester goes on. Thank you.